Hernia is any visceral organ, any organ inside our body. If it is protruding out abnormally, then we call it as hernia. There are so many types of hernias. Some hernias we can see it from outside, some hernias we cannot see, they are called internal hernias. Those hernias which we can see outside, we can classify based on their location in the body. It can be a ventral hernia, it can be inguinal hernias. So there are many types of hernias. Usually hernia presents as a swelling, as a bump, which abnormally you don't see, and this swelling may be associated with pain. Sometimes these hernias can get complicated, like inguinal hernia can get complicated and the person might develop distension of abdomen, vomiting and all. Usually it is the swelling. Hernia usually presents as a swelling, as a bump. It becomes more symptomatic when it gets complicated. Many people live with hernia because it doesn't cause any problem. Usually it comes out and goes in. It is as easy as that. But once it gets complicated, they develop pain, they develop vomiting. Sometimes it can go to the extent of gangrene of the bowel and all. So these are the complicated situations. So usually people live with hernia because it is not causing any problems. The most common complication is pain and irreducibility. There are no ways to prevent a hernia. Only thing is we can diagnose it early and get it treated as early as possible. It is usually not advised to keep a hernia untreated. Okay? And there are some situations where we don't suggest a surgery, like if it is a huge hernia or if the person's physical condition is not apt to undergo surgery, then we suggest non-operative conditions. Otherwise, usually diagnosing a hernia and treating it as early as possible is the treatment.